Finally, I just want to very briefly introduce Anna Gorman. She's with the LA Times, as I think you all know by now. I would just say on the Hill today, I think she has a secret passion that I've never seen in a congressional office before. It's this ability to sort of just get in there and ask the right question and have the right statement at just the right time. We were talking about it actually when we stepped away. She's clearly a reporter. She knows what she's doing. She's been a really passionate, came up a few times in her application, passionate reporter on the issues of health impacting the Los Angeles area, on any host of public health issues from vaccination, childhood obesity, and has really focused in a very terrific way for the public health community in covering those stories for the public. I think we mentioned this in a number of the congressional meetings we were in today. It is a huge challenge for public health experts like Matt and Wade to take the messages that they know and work on every single day and explain them to populations of hundreds of thousands, if not millions. And so 2 years ago, one of our board members, Jenny LeRae, had the idea of, we should recognize the role that media plays in that, and we should give an award to a media person who takes those stories and really explains it to the public in a way that's easy to understand and can change behaviors and help the public's health. And Anna Gorman beat out the very stiff competition and is really, truly, I think, when you hear her speak, an excellent person to win this award. And congratulations. Thank you.
Thank you so much, Carl. So last summer, while I was reporting a story, I met a little boy named Marco Cisneros. He was an 8-year-old kid who loved soccer, he loved playing video games, he loved having play dates with his friends. But he also had really severe asthma, so severe that he had been hospitalized dozens of times, been airlifted to hospitals around the region to take care of his asthma. He had a brand new red bike in his yard, but he'd never ridden it because he was afraid it would trigger an asthma attack and he'd end up back in the hospital. His case, this case of Marco Cisneros, made really painfully aware to me of how poverty and place impact health. Marco lives in a city or county in California that has the highest rate of hospitalizations and of ER visits for pediatric asthma. It's an agricultural area near the Mexican border, and it's very poor. Most of the people, in fact, most of the families are either uninsured or on Medi-Cal, our version of Medicaid. So his case also, this story also made me aware of just the tragic health disparities that California faces. There are disparities that we see in everything, in obesity, in quality of hospitals, in infant mortality, in a host of issues. And it made me even more committed to writing about these issues. I was lucky enough to do a fellowship a few years ago in Boston, and I took a class by a public health professor, and he posed the question to his students that if you want to know the future of somebody's health, what is the most critical indicator? And the answer was, look at the parents. Look how educated they are. Look how much they earn. Now, I've been really lucky in my life to be born into the family that I was born into, but a lot of the people that I write about aren't as fortunate. And so I see it as my role as a reporter to write about these issues in a real intimate way and to let readers know through real people what this looks like, who these people are that are affected by health disparities and public health problems in our society. And it's my role to hold legislators accountable and to push them on issues. But it's also my role to educate the public, and in addition to highlighting problems, to highlight people who are making a difference, like my colleague Matt and Wade, had I been able to meet him today, and others around the country who are actually doing this public health work. That's how I came across a woman named America Bracho. She's located in Santa Ana, California. It's about an hour south of Los Angeles. It's one of the poorest cities in the nation. And she's a Venezuelan-born doctor and public health advocate. She started an organization called Latino Health Access. And early on in her career, she met a man who could not afford, he had diabetes, but he couldn't afford the eye exam that he needed. So he and some other classmates, they were doing an education program, came up with the idea to sell tamales. To raise money for this test. And so they did. They sold tamales and raised money for him to have this exam. And that began a career of public health advocacy in this very poor area. She's brought parks to the neighborhood. She started a community worker promotora program. She started a domestic violence program, all for this community. And much of it still paid for by selling tamales. So it's people like America Bracho and my colleagues, my fellow award winners today, that make my job easy as a reporter. And it's people like Marco Cisneros, the little boy, that make me realize how important the work I do as a journalist is to get the word out, like I said, through intimate portraits of people about public health problems. So I really can't thank you enough for the honor of being here today. It's really nice to get recognition for the reporting that I've done and the reporting that a lot of my colleagues have done around the nation on public health issues. There aren't as many of us anymore as there once were reporters, but we are still fighting and we are still doing our jobs. And I appreciate my boss's support of the kinds of things that I want to write about, which include, the things that I've talked about today and the things that Carl talked about. So thank you so much to the organization, and thank you to the board. Thank you for the judges for selecting me, and thank you to Carl for everything you've done for the Campaign for Public Health Foundation. Thank you.